Hello everyone, it's my great honor to attend today's meeting. The title of my speech is Experiences of Social Isolation Among Elderly with Disabilities in China, a Qualitative Study. The research includes the content of above 4 parts. Firstly, objectives. With the accelerated pace of aging, the number of disabled elderly people in China continues to rise and expected to reach 91.4 million by 2015. The phenomenon of social isolation of disabled elderly people has gradually received extensive attention. Social isolation refers to a state of active or passive derailment from society in which activity, participation, social interaction, and interpersonal communication are in a state of disruption or isolation. Disabled elderly people are at high risk of social isolation, and the incidence is about 27 to 33%. Social isolation is considered to be an important indicator of public health, which is closely related to health outcomes. Through qualitative research, can deeply explore the experiences of social isolation of disabled elderly people and analyze and understand the process of social isolation and the specific cultural background. Therefore, this study conducted in-depth interviews with disabled elderly people to explore their real experiences of social isolation, so as to provide the reference for the formulation of nursing support programs for disabled elderly people, help them rebuild their lives, reintegrate into society, and promote healthy aging. Secondly, design. Purpose sampling method was adapted to select the subjects according to the principle of maximum differentiation. According to the gender, age, education level, and the social isolation degree, the disabled elderly in a community in Zhengzhou City from October to November 2023 were selected as research objects. This study has been approved by the Ethics Committee of Zhengzhou University. The participants' inclusion criteria include age more than 16 years old, Chinese version of Basel index scale score less than 100 points. The total item score of the Laban social network scale 6 is less than 12 points. Understanding, communication, and expression skills are appropriate and can cooperate with researchers to complete the investigation. Informed consent, voluntary participation in this study. And the exclusion criteria is with other systematic complications or being critical condition. When the collected interview data reached 30 cases, there was no more new information. In order to further confirm whether the data really reached saturation, 3 more interviews were added, and no new topics emerged. Thus, the interviews were stopped. Therefore, a total of 16 interviews were interviewed in this study. The following table provides general information about the participants. The above is an interview outline for this study. Semi-structured, in-depth interviews were conducted in the form of one-to-one and face-to-face to collect data. Interviews were interviewed for 30 to 45 minutes according to the interview outline. During the interview, a recording pen was used to record, and the changes in body movements, speech speed, and expressions of each respondent were recorded in detail. Data analysis. Within 24 hours after the interview, the research transcribed the recorded interview data into text verbatim, and the data sorting and analysis were carried out simultaneously. This study adapts the Qualitative stem analysis method to extract that theme. Thirdly, results. As shown in the table, a total of 3 themes and 11 sub-themes are formed. Theme 1. Causes of social isolation. Self-factor. Many respondents said that due to physical disability, functional impairment, and pain caused by illness, they couldn't complete many things independently, increased their dependence on others, and felt powerless to participate in social activities. This means decreased ability to participate in society, and some respondents revealed that due to physical or psychological reasons after illness, they will actively reduce social interaction, lack of enthusiasm to participate in social activities, and are more inclined to stay in their own feeling safety zone. This means lack of motivation for social integration. Family factor. Many respondents said that due to the distance in space and their inability to use communication tools such as smartphones, they are not close enough to interact with their families. This caused lack of family emotional support, and also some respondents mentioned that their families persuade them to stay at home as much as possible, fearing that going out to events and socializing will involve safety issues. Social and environmental factors. Most respondents said that they have a large demand for medical and health service resources, but the nearest community health service center cannot meet their diversified needs. And many respondents also mentioned that because travel is not convenient enough, many things cannot be completed independently as their own needs haven't been met. Theme 2. Experiencing social isolation. Firstly, loneliness. Some of the interviews confided that they sometimes felt disconnected from the world outside their home and experienced significant loneliness. Secondly, negative emotion. Some respondents said that they often feel very low and have little interest in many things. Thirdly, feeling of hopelessness. Some interviews reported feeling strongly helpless in terms of needs and acute illness. Finally, self-denial. Some interviews said that they sometimes doubt their abilities, feel useless, and don't know what is the point of living. Theme 3. Strategies to prevent social isolation. Firstly, enhance self-efficacy. By interpreting the life meaning of the elderly, we can help them regain the hope of life in old age. By excavating the value of the elderly themselves, they can play a new social function role and then face the stressful events in life positively and optimistically. By helping the elderly to have positive changes in their self-perception, they can adopt a more calm attitude toward life and welcome gains and losses. Secondly, promote family interaction. By promoting communication and interaction among family members, the well-being and sense of belonging of disabled elderly people can be significantly enhanced. Thirdly, building neighborhood network. Seeking community and neighborhood support resources can effectively relieve the psychological pressure of disabled elderly people and regulate negative emotions. Improve infrastructure. Through the transformation of infrastructure suitable for aging, the opportunities for disabled elderly people to participate in social life can be increased and the problem of social isolation can be solved. Finally, conclusions. This study conducted in-depth interviews with 16 disabled elderly people and found that the social isolation problems of disabled elderly people were mainly caused by factors such as their own decreased ability to participate in society, lack of motivation for social integration, lack of family support, and small social support. Therefore, nurses should pay more attention to the current situation of social isolation of disabled elderly people, take measures to improve the self-efficacy of social isolation of disabled elderly people, promote their self-enhancement, and strengthen the multidimensional social support of disabled elderly people, promote their social integration, and help them return to society as soon as possible. Also, there are some limitations about this study. That this study only conducted interviews in the community or family and only interviewed disabled elderly people themselves. Follow-up interviews should be conducted in hospitals, nursing institutions, and other environments to understand the problems and needs of their family caregivers, so as to provide a more comprehensive reference basis for the formulation of nursing support programs for this population. Okay, that's all. Thanks for listening.